Hello, I'm Suzanne McAllister, and this is Full Circle. I'm glad you could be with us today. We're going to be talking about some very serious issues that many people are experiencing, especially baby boomers. In fact, we're going to be talking about depression, rates of suicide, and things you can do to make your life better. Here to lend her expertise, it is my absolute pleasure to introduce Dr. Natalie Dattilo. She is, and I'm going to read this, a licensed clinical psychologist specializing in cognitive behavioral therapy techniques. Dr. Dattilo provides psychological treatment of depression and anxiety, as well as other common health concerns. She has her PhD in clinical and health psychology from the University of Florida and completed her pre- and postdoctoral fellowship at the IU School of Medicine. Welcome to the program.
Thank you. Thanks for having me.
So, Doctor, are you concerned that more and more people are showing up in offices like yours throughout the country with depression, with thoughts of suicide?
It is concerning. It's concerning to see the rates of depression on the rise, especially with the baby boomer generation. I think there's lots of reasons for that. Some of the most prominent ones are phase of life transitions. So facing retirement. Having worked for most of your life and then needing to make the adjustment to not doing that anymore, and what does life look like without that aspect of it. I think what we're finding now that's maybe different than past generations is something that we've called the sandwich effect or the sandwich generation, which implies that baby boomers are experiencing difficulty because they have adult children that they are still taking care of, either financially supporting them or possibly even emotionally supporting them because they're having trouble finding work or starting their own family, their own life. And they're also taking care of their aging parents who are unwell and are requiring some assistance. And so that's very, very stressful.
Absolutely, and you talk about that sandwich generation. It's almost
squeezed.
Like the big squeeze, yes. So if our audience, somebody at home recognizes themselves, they're caring for their kids, they're caring for their aging parents, they're here in the middle and they're trying to take care of themselves, what advice do you have for them? Because, I mean, at some point we need to stay healthy.
Exactly. I think that's probably the most important part. If we're not well, we're not able to take care of our loved ones. So it's first recognizing that maybe you are stretched a little too thin. Finding support wherever you can, whether that's with friends, other family members, maintaining interests, whether those are hobbies, whether that's exercise, staying active, having a wide range of interests, I think are these are the best things that we can do to maintain health and wellness.
You know, you mentioned about staying active and having interest. As I was telling you, we've gone through a move, and moving can be very stressful. And the other day, I just took some time out to go to the Indianapolis Museum of Art. And even though I didn't have real time on my hands, I just felt like it was a way to step back from the stresses in my life and to be able to just kind of regenerate myself. What are some other things that baby boomers, sandwich generation especially, can be doing to regenerate themselves?
I think the most important thing is to stay healthy as possible. I think one of the other things that begins to compromise our emotional health is when our physical health starts to, it starts to be compromised, and that can certainly limit our ability to take care of ourselves and other people. So staying active, staying healthy, following a healthy diet, those sorts of things, maintaining an exercise regimen, I think.
Well, you know, the baby boomers, we just felt like we could do it all, and we have that attitude that we don't need any help. But obviously, we do sometimes hit the wall. What are some of those serious signs and symptoms in our own self, or maybe a loved one, should we be aware of that perhaps it's shifting from being, slightly sad to a real clinical depression?
I think some of the most obvious signs are withdrawal. These are the behavior signs that we tend to look for. So not just somebody who's sad and seems sad, but they really don't seem or feel like themselves. And so it's really hard to get the energy and the motivation to do things that they used to enjoy. And they begin to question, what's the point anyway? So that's probably one of the things that I look for first is, have you stopped doing the things that you enjoy? And if you thought about doing the things that you like to do, does that even sound like fun to you? So people begin to question, well, why would I do that anyway? What's the point? A sense of apathy begins to set in, and that's a real red flag, that it doesn't matter anyway.
So then that obviously left unchecked, and we talked about the increased rate of depression, but also the parallel increased rate of suicide as well.
Right, right. So left unchecked, left untreated, it can certainly spiral into something where people begin to think, well, what's the point of doing anything? It will never get better. It will always be like this. Hopelessness and helplessness begin to set in, and that's when a sense of despair can take hold, and that's when people really begin to entertain thoughts of suicide.
Well, certainly it is a very serious issue. We need to take a break, but we'll continue our conversation after this. Welcome back to Full Circle. We are continuing to talk about depression and rates of suicide among baby boomers. Our guest today is Dr. Natalie Dattilo. We left off by talking about hopelessness and helplessness. And if we find ourselves saying, you know, I'm withdrawn, I don't really enjoy life anymore, why should we seek out the help of a professional like yourself?
When that sense of helplessness, hopelessness, powerlessness to change, and that sense of apathy about life begins to set in, we consider that to be a very serious situation. And so I would strongly encourage anyone to seek help, seek treatment. And that could come in the form of seeking some medication treatment or some talk therapy, both of which have been proved to be very, very helpful.
So you specialize in talk therapy. Talk about cognitive behavioral therapy and how that can be extremely helpful.
Okay. The evidence suggests that the talk therapy that I do, cognitive behavioral therapy, is as effective as medication therapy for lots of people. And it often depends on a person's preference as to what type of therapy they'd like to receive. And I do work with a lot of people who also take antidepressant medication and find that to be helpful as well. The techniques that I use include restructuring a person's thoughts. I also use techniques based on mindfulness-based therapies and acceptance and commitment therapies, and those can be very, very helpful for people as well.
So why don't you expand a little bit on that mindfulness-based therapy?
Mindfulness is a technique that we use in therapy to help people stay focused on the present and cultivate a sense of appreciation for what's happening right now, as opposed to getting caught up in things that happened in the past that they can't change, or worry about things that might happen in the future that they may not be able to do anything about either.
So they really have to change their thinking and be aware of what their thinking is doing to their overall well-being.
Sure, it's a way to really cultivate a sense of what am I thinking about, and is it helpful for me to be thinking about it in that way?
So do you think people just worry a whole lot about the past and they fret about the future, and oftentimes that has a real chemical reaction in how they're feeling physically?
I do think that folks who are prone to depression and anxiety do tend to spend time ruminating on the past or being excessively preoccupied with the future. And so mindfulness and other techniques that we might use help people stay grounded in the present and to cultivate a sense of appreciation or a non-judgmental stance. We spend a lot of time judging ourselves and our experiences, which tend to cast a very negative light. We don't tend to think about ourselves as positively as we should sometimes.
That's a good point. We need to be our own best friend, don't we?
We do.
Now, some people have the ability to compartmentalize their life. They're able to, deal with certain stresses and then move into maybe a volunteer situation and kind of leave that behind. Is that a helpful technique in terms of being able to structure our thinking in the course of our day so that everything isn't just all very stressful?
I do think that people who have the capacity to compartmentalize in the way that you describe can be very, very helpful and very healthy. I think we all are faced with stressors in our life that affect us, that we need to be able to set aside in order to do what we need to do to accomplish the things throughout the day that are important to us. And I think sometimes it's easy to get caught up and be overly preoccupied by the things in our life that are causing us stress, that they tend to consume us and then take over. And those are when we're at most risk for things like anxiety and depression to set in.
Sure.
And we can't do that.
Exactly. So we have to be able to separate the things in our life that's causing all of that stress. But again, many people find themselves stuck, and they find themselves, well, what's the use? So what advice do you have for someone who still is like, you know, I've tried this, it hasn't worked?
I do recommend talking to someone. I think sometimes, again, sometimes we don't enjoy asking for help. Some people find that to be some sort of admission of weakness, and I think, but it's very difficult to see the ways in which we're living our lives that are unhelpful until we have somebody outside of the situation who begin to sort of gently point those things out. And so it usually is an objective person who's not emotionally involved in the situation, who's able to look at it and help that person see it more objectively and proceed in a helpful way.
And I think that's really important, to talk with someone, as you just said, that's not emotionally attached to it, because that does not give you that objective viewpoint.
Right. We need some distance from the things that we're experiencing and the things that we're thinking about in order to evaluate them and decide whether it's helpful or not.
Well, we are continuing to get some wonderful advice from our guests on today's program, but we have more after this short break. Don't go away. Welcome back to Full Circle. Well, we are talking about some serious issues on today's program, increasing of the rates for depression and suicide among baby boomers. We've been talking with our guests from the IU School of Medicine, and we're going to put this website up on the screen so that if you need some help for yourself or perhaps a loved one, you can reach out and get the help you need, which is certainly a piece of advice that our guest, Dr. Dattilo, has told us about. So, Doctor, let's talk a little bit about the mind-body connection and how if we're not having healthy thoughts, perhaps it shows up physically in our well-being.
Sure, we experience stress every day, and we say that that's unavoidable. I think chronic stress and stress that we don't keep in check can begin to show up in very toxic ways in our body. Some of the most common ways that we experience stress would be in the form of headaches, tension in our muscles, so muscle aches, stomach aches, I think pain. Things like insomnia and poor appetite, I think, can also be affected by the levels of stress that we're not managing well.
So if we start to manage the stress, then physically we might expect that we would be getting better as well.
Yes, yes. And so we talk about coping. And so how do you cope with stress and the everyday stressors that begin to build up, and they become cumulative, and that's the point in which they can become toxic.
So what are some of those coping mechanisms? Because that's what we need to be able to do so we can deal with these, as we were saying earlier, especially with the baby boomers who are in that sandwich generation.
Some of them can be as simple as just taking a walk, getting up, getting active, moving, finding something that you enjoy doing and do it every day. It doesn't have to be for long, but a little bit of time spent just doing something that you enjoy that allows you to unwind and sort of unplug from the day. And that could be reading, it could be pampering yourself, it could be calling a friend, calling a family member, journaling, writing, praying, exercising. All of those things have been found to be very, very helpful.
Yes, absolutely. Let's talk a little bit about the journaling. Why is that important, and what might you capture in your journal if you do decide to use that as a coping mechanism?
I think for people who journal, they find it very, very helpful to have a place to put their stuff, the stuff that's on their mind and the stuff that's bothering them, as opposed to carrying it around with them everywhere they go. It's a form of compartmentalization, like we talked about earlier. So it's a place to put down your thoughts, your worries, your concerns, and then you close it and you put it away. And it sort of serves as a container for those things so that you don't have to worry about them so much.
I remember running into somebody at a high school reunion, and he said, you know, you get to a certain point in your life and you really can have a lot of baggage that you're carrying around, or you can just be willing to let it go. And isn't that what we're talking about in some situations? Letting go of those false expectations, letting go of those high standards, or letting go of the past that you were talking about.
Yes, this is coping. This is dealing with the things that we carry around with us, or the things that are happening right in front of us that tend to overwhelm us or tax us. So it's easier said than done. I will say that.
Yes.
I think people struggle with this idea of how do I let it go? And it comes down to choosing to do that. You choose to let it go. You choose to put it behind you, and you choose to move on.
Yes.
And you do things differently than maybe you've done in the past.
And moving on to a healthier place, to a more fulfilling place. And doesn't that oftentimes mean perhaps not doing so much and slowing down and relaxing along the way?
Exactly. I think we do too much. And I think that our society puts a premium on the more you do, the more successful you are, the more active you are, the more productive you are. And I think one of the things we really need to focus on doing is slowing down and doing less, doing one thing at a time and doing it really well.
And I was talking with a friend who keeps a calendar, and she used to always fill it up with appointments and schedules and things. Now, much wiser woman, she is blocking out time for doing nothing. And I think sometimes that is what we need to do. So, doctor, if we are concerned perhaps of a loved one, how do we approach? I mean, it's easier if we say, I need some help, I'm going to call Dr. Dattilo. But if we find a loved one who's just stuck and struggling, how can we be of assistance without feeling like, you know, you're sick and you need help kind of approach?
Right, and I run into this issue quite a bit. Is how do I get help for my loved one who either doesn't acknowledge that they need help or doesn't want to? Well, again, you have to take care of you. You have to be well in your own mind and in your own body to be able to take care of other people that we love. And by that, we sort of also model for them what it looks like to take care of yourself and to pick yourself up when you struggle. I think being supportive is the other best thing that we can do for our loved ones, which is not, you know, nag them or push them into something they don't want to do, but tell them, I'm here for you. And if you want to get help, we will get help. Okay.
That's good.
And kind of having those resources on hand for yourself so that if they do come to you and say, I think I'd like to get some help, you say, great, I know the place to go.
And be supportive. And I think too, some people expect that it's just going to be an automatic change and a shift. This takes time to become fulfilled and happy and grounded.
It takes time, and it's worth the time that it takes because it's important work. And so if it takes months to years to really realign your life and live according to things that are the most important to you, I think those are the secrets that we share as far as living a more fulfilled and happy life.
Well, I'm sure the clients that you see on a regular basis have appreciated your approach and no doubt are living that more fulfilled and realigned life. I like that expression, a realigned life. Dr. Natalie Dattilo, thank you so much.
Thank you, Suzanne.
Our guest is with the IU School of Medicine. The information is up on the screen if you'd like to reach out and get more information on how you can realign your life if you need that. Well, don't go away. We are back with our music after this.
Musical Showcase is brought to you by Flanner & Buchanan, helping families tell the story of their loved one's life. Musical Showcase is brought to you by Flanner & Buchanan, helping families tell the story of their loved one's life.
Welcome back to Full Circle. In our music segment today, we are featuring Luann Wheeler. She's going to perform Rock of Faith. Well, I hope you enjoy the performance, and I do hope that you'll join us again on Full Circle because we always love having you be a part of our program.
The rock of faith is Jesus, and on this rock we stand. His name is like a tower raised high above the land, and from this rock of danger we run to him and find the grace that keeps our spirits, the peace that guards our minds. Praise the rock, praise the mighty rock. The rock of faith is Jesus, and within this rock we hide. He draws us to his presence and calls us to
Closed captioning provided by Hear Hear. Hear Hear, discreet hearing solutions at affordable prices. 317-731-5386.